Good day, doctors. Today we will discuss fluoride prevention of caries, mechanism of fluorides actions, endogenous and exogenous methods, and means of fluoride prophylaxis of caries. Lecturer Makusheva Natalia Vячеславовна. Goal of the lecture: to study methods and means of caries prevention, indications for use, mechanisms of action, and methods of applications. Caries is one of the most common diseases in the world. According to some reports, it is one of the three leaders. Due to this prevalence and a number of other factors, it became necessary not only for local but also for systemic preventive procedures. The importance of fluoride in the prevention of dental caries is very high. The result of optimal fluoride intake during the period of maxillary tooth development is formation of fluoropatids and, as a consequence, straining of the enamel of the tooth. The constant presence of adequate mineral levels of fluoride in salvia increases the remineralization of enamel. Even if the amount of fluoride is minimal, but it will enter the body every day, this will straighten the enamel and increase the remineralizing ability of salvia. Fluorine ions are capable of incorporating apatids. Hydroxyl ion in the crystal apatid lattice can be substituted with the fluorine ion. The fluoropatid form at the same time has greater chemical resistance than hydroxyapatid, which causes its higher resistance to damaging agents. Due to this, fluorine ions reduce the solubility of enamel, which is determined by their ability to fix the edge of the growing crystal, protecting it from the effects of acids. As a result, the action of cariogenic factors on enamel is braked. Fluorine is able to accumulate in enamel in bone tissue, retain phosphorus and calcium, thereby increasing their content, which produce a certain positive effect on pathologically modified solid tooth tissue and periodontics. There is information about the positive effect of fluorine on the process of osteogenesis and cholesterol metabolism. Fluorine delays the development of the atherosclerotic process in the vessels. Fluorine prevents the absorption of organic substances and microorganisms on the surface of the tooth, changing the electric potential of the enamel. At low concentration of fluorine ions, albumin and salvia glycoproteins are desorbed. Fluorides have a bactericidal and bacteriostatic effect. Co-growth and reproduction of bacteria, including streptococci, inhibit the activity of bacteria enzymes in the oral cavity and dental plaque. Fluorine has a reducing effect on glycolysis process. The longer exposure, the smaller concentration of drugs is required to destroy bacteria. Fluorine inhibits the enzyme analyzer, as a result of which the glycolysis cycle is interrupted and the formation of lactic acid is decreased, which is streptococci. At the same time, the fact of the inhibitory effect of fluorine preparation on the activity of some enzyme system, in particular redox and hydrolytic not only microorganisms but also a macroorganism, was established. It was found that fluorine in high concentration inhibits the activity of phagocytes. Pathogenetic prevention of caries shares on endogenous, systematic, and exogenous, local, which in turn are divided by medical, drug, and not medical, non-drug. In the post-eruptive period, the cardioprotective effect will be low if you will use systemic endogenous method of fluoride intake in the tooth. This method from blood, water and food, for example. This method for structurally bound fluoride in the form of fluoropatids, so this method will be good when teeth are not erupted. Because of this method for the deep layers of enamel, and the high cardioprotective effect in post-eruptive period will be with local exogenous method of fluoride intake in the tooth. This method, when fluoride arrives to the surface of the enamel from salvia, the formation of a layer of calcium fluoride, and high cardioprotective effect after erupted tooth. And the first method of fluoride intake in the tooth is systemic or endogenous method of fluoride prophylactic. When we use systemic endogenous method of fluoride prevention of caries, fluorine enters in the body from drinking water, edible salt, milk, pills, drops, etc. You know that fluorine is the most active chemical element in nature, and in a free state it doesn't occur. Fluorides are found in soil, rocks, seawater, fresh water, etc. In the human body, the fluoride comes from air, from water, from food. In the human body, the fluoride comes from air, from water, from food. Dosage fluoride prevention is a reception inside drugs that ensure the mineralization of the enamel and dentin tooth through the pulp, odontoblasts, dentin liquor, salvia, and for this purpose the preparation of calcium, phosphor, fluorine are prescribed. Preparation of calcium, phosphorus, fluorine are prescribed for receiving inside by a child with a dentist together with a pediatrician. There are two fluoroprophylaxis strategies according to the World Health Organization. The first is the constant non-intensive impact of fluorides, And second, the periodic impact of high concentration of fluoride. Mechanisms of anti-caries action of fluoride will be stagnating remineralization and operation of demineralization. Second one is the depression of the process of glycolysis. And the third one is reducing the solubility of enamel from the effect of acids due to the formation in fluorapatites to teething. So, we are considering endogenous drug prevention of caries using fluoride, and this section includes prevention with fluoride tables and drops. The indication for this method are: children have a high incidence and intensity of caries. Second one, high individual risk of developing dental caries in a child with an average of low level of dental caries. And the third, the fluoride content in drinking water is below that 50% of the optimal concentration. And contraindication to this method will be use in the region of another method of systemic prevention of caries. Fluoride content in drinking water more than 0.6 milligrams on liter. The child is less than 6 months old. Okay, systemic endogenous drug fluoride protection method. And we will discussing fluoride tables. Sodium fluoride tables are in different forms: 1.1 milligrams and 2.2 milligrams sodium fluoride. For example, pearl teeth, a homeopathic preparation, contains sodium fluoride and calcium preparation. The second one, for example, Vitaftor or Vitalux, this is sodium fluoride and a parts of vitamins. The drugs is used by 250 days a year. As I said, there are two ways to use fluoride to prevent tooth decay. Method 1 is the minimum dose but every day. And the second way, the use of tablets with a high concentration but in courses. So, let's consider the option of daily use of sodium fluoride tablets and recommended daily doses. If the content of fluoride in drinking water is less than 0.3 milligrams on liter, for children from 6 months to 3 years, recommended a half of tablets of 1.1 milligrams sodium fluoride per day. From 3 to 6 years old, a half tablet for 2 times a day. And from 6 to 16 years old, 1 tablet 2 times a day. And another method, when the content of fluoride in drinking water is from 0.3 to 0.6 milligram on liter. And for children from 6 months to 3 years, we will not use tablets. From 3 to 6 years old, a half tablet 1 a day. and from 6 to 16 years old, a half of table 2 times a day. For example, Vitafluor is a combined preparation containing, in addition to sodium fluoride, vitamins A, C, and D. Vitafluor is a light yellow liquid, bitter in taste, with a slight specific odor. 1 spoon of the drug contains retinol, palmitate, vitamin A, 3,300 or 0.2018 gram. Ergocalciferol, vitamin D, and ascorbic acid, vitamin C, and sodium fluoride 1.1 mg, respectively fluorine a half of milligram, active fluorine. The action of Vitafluor is due to the combination of fluorine with vitamins, which contribute to the correct formation of not only teeth and bones, but also the regulation of the exchange of phosphorus and calcium in the body, and the prevention of fluoride intoxication. The medication can only be used with the consent of the pediatrician. It contains systematic vitamins, the introduction of which must be justified. It is recommended to dissolve the tablets in the oral cavity for local absorption of fluoride ions into the enamel of the teeth. Thus, at the same time, there is an exogenous effect and then an endogenous effect after swallowing the components of the tablets. Benefits of using fluoride tablets. Cheap and simple technology for the production of the drug. High efficiency of caries reduction. If the child regularly took the drug from 6 months to 16 years. Sucking and chewing the tablets increases the local effect of the tablets. The right to free choice of fluorides is ensured. No needs for dental staff. High economy efficiency. Disadvantages of using fluoride tablets. First one is high risk of developing fluorosis. Second, the need to ensure the safety of storage of material. Third, unstable prophylactic effect in the area of fissures and fossas of teeth. And fourth, the regulatory and required duration of use is often not observed. So, systemic endogenous non-drug fluorine prevention of caries. Non-drug systemic endogenous prevention of caries will be consist of: first one, rational balanced nutrition, including breastfeeding. Second one, treatment of chronic diseases of the child. Third one, observance of work and rest regimes. physical education. And the last one, fluoridation of drinking water, milk, and salt. Rational nutrition plays an important role in providing the hard tissue of the teeth with minerals. The most balanced in terms of the amount of calcium, phosphorus, fluorine, and fatty acids is milk, including goats and dairy products, lactic acid, hard cheese, cottage cheese, etc. Calcium is also found in egg yolk, eggshell powder, oatmeal, nuts, legumes, meat, vegetables, etc. A balanced amount of calcium and phosphorus contain apricots, peaches, cherries, plums, sweet cherries, sea and river fish. A large amount of phosphorus and fluoride is found in sea fish, mackerel, salmon, sardine, krill meat, crabs, seaweed. The highest grades of black, Georgian, and green tea are rich in phosphorus and fluorine. Endogenous drug-free method of caries prevention include the prevention of somatic diseases in children. Risk of, first of all, rachis, which is a sign of violation of mineral metabolism in the body and can be the cause of inadequate mineralization of not only the skeletal system, but also teeth, both milk and permanent ones that have been laid by this time. It is important to ensure normal gastrointestinal function. Prevention of dyspepsia, intestinal dysbiosis, or their timely treatment contributes to the normal absorption of food, include its minerals components. Prevention of all other common diseases of child, including infections, colds, etc., plays an important role in the prevention of caries since it prevents a decrease in general immunity, contributes to the normal function of odontoblasts in the dental pulp, which are responsible for the mineralization of enamel, especially at the stage of intramandibular tooth development. It is very important to observe the daily routine, sleep and nutrition. This contributes to the normal development of the child, stimulates the formation of immunity, allows you to cope with infection and stress, regulates the normal function of the gastrointestinal tract. No wonder there is a proverb, in a healthy body, a healthy mind, and on Latin language, mens sana in corpore sano. Systemic endogenous non-drug method, fluoridation of drink water, milk, salt, and this administration for the prevention of caries requires regular monitoring and compliance with safety measures. Since fluorine is a chemically aggressive element and the concentration threshold from positive to negative effects is very low. So, optimum fluoride content in drinking water is 0.7 to 1.2 milligrams on liter or ppm. ppm is part per million. Thus, it should be remembered that fluorines are a protoplasmic poison that inhibits metabolic process. Therefore, an overdose of fluoride can be dangerous to the health and sometimes to the life of child. The concentration of fluoride in water will vary depending on the climate. For example, 0.8 mg per liter for hot climates, 1 mg per liter for temperate climate, and 1.2 mg per liter for cold climate. For the first time, artificial fluoridation of water was introduced in 1945 in the United States of America. Now it is held in 39 countries, USA, Canada, Australia, Russia, etc., and covers more than 300 million people. In Soviet Union, water fluoridation began to be introduced in 1960 in Norilsk. In 1990 was created state standard for drinking water and was named as Drinking Water, Hygiene Requirements and Quality Control. Indication for water fluoridation by World Health Organization are: the concentration of fluoride in drinking water is less than a half of milligram per liter. Caries intensity medium, high or very high. Trends towards an increase in the incidence of caries. Advantages of this method: coverage by prevention of all resistance of the communal water supply site, high efficiency, reduction caries of deciduous teeth is about a half of residents and more, helps reduce the prevalence of periodontal diseases, cheap, less than 50 cents per person per day, high cost effectiveness, no need to involve dental personnel. Condition of conducting: municipal water supply system that covers the majority of the population, sufficient level of economic and technical development in the region, availability of equipment required at water intake station, reliable source of fluoride, availability of well-trained personnel to work on fluorine installation, mandatory monitoring of the intensity of caries and fluorosis. Disadvantages of drinking water fluoridation: cannot be carried out in settlements that are not provided with centralized water supply, not economically available in small settlements, there is no freedom of individual choice, insufficient preventive effect in the area of fissure and pits of the teeth. And the next method is fluoridation of salt. In terms of efficiency, it is equivalent to the fluoridation of drinking water. The maximum effect of fluoridated salt in caries prevention is achieved when it is consumed throughout a person's life. Fluoridated salt shouldn't be consumed in areas where there is an optimal fluoride content in drinking water, or where other systematic fluoride programs are being implemented. The optimal fluoride ion content is 250 to 350 milligrams per kilogram of salt. Fluoridation of salt first started in Switzerland, Zurich, in 1955. Now, salt fluoridation is carried out in Hungary, Latin America, Australia, Belgium, Belarus, Spain, Slovakia, Czech Republic, Russia, etc. Indication for salt fluoridation. The first one is the concentration of fluoride in drinking water is less than a half of milligram per liter. High prevalence and intensity of dental caries. And the last one, impossibility of fluoridation of drinking water. Disadvantages of the salt fluoridation method. The first one is difficulty distributing salt. The next one is complex technology. And the last one, obligation to monitor the level of fluoride in water. And the next one method is fluoridation of milk. Fluoridation of milk is one of the most promising methods in the endogenous prevention of caries. Methods have been developed that allow fluoridation of milk prepared in various ways. Pasteurize, sterilize, high temperature processing, and in the form of a powder. For fluoridation, natrium fluoride is often used, less often natrium monoftorphosphate. The amount of fluoride to be added to milk should take into account the child's age and daily fluoride intake. In accordance with the World Health Organization recommendation for child from 3 to 7 years old, the total intake of fluoride from all sources, water, food, drinks, medicine, etc. should be from 0.8 to 1.7 milligram per day. Based on this recommendation, drinking 1 glass of fluoride milk per day, children receive a half milligram of fluoride, which provides a daily total intake of 1 to 1.15 milligrams of fluoride per day. This dose is safe for the child's body. For the first time, fluoridation of milk was introduced in 1988 in Bulgaria. Now positive experience in Bulgaria, Chile, China, Russia, and England. Fluoridated milk can be produced in various forms. First one, liquid, pasteurized, sterilized, high temperature, etc. And the second one, in powder. Indication for milk fluoridation will be the concentration of fluoride in drinking water is less than a half of optimal concentration. high prevalence and intensity of dental caries in the population, and impossibility of introducing method of fluoridation of drinking water or salt. Benefits of milk fluoridation. Fluoridated milk, a natural product for child, combines the beneficial properties of milk and fluoride. Carries prophylactic effect for deciduous teeth from 30% and for permanence the same. Fluoridated milk production is cost-effective and technologically simple, and no need to involve dental staff. Disadvantages of milk fluoridation are: first one, lower population coverage. The program applies only to children of preschool and primary school age. Second one is insufficient preventive effect in the area of fissure and fossa of teeth. And the last one, monitoring of the intensity of caries and fluorosis in children is required. The next group of methods of fluoride intake in the tooth are local or exogenous methods. The term topical fluoride therapy refers to the use of system containing large concentration of fluoride that are applied locally or topically to the erupted tooth surface to prevent the formation of dental caries. Advantages to the local use of fluorides. First one, doesn't cause fluorosis. Second one, preventive effect for people of ages more than 3 years. Third, available to people who desire it. And fourth, easy to use. Disadvantages of topical fluorides. First, person must remember to use. Second, per capita cost is higher compared to water fluoridation. And third, more concentrated professional use products can cause short-term side effects like nausea immediately after use. Not all fluoride agents and treatments are equal. They are different. Fluoride compounds, vehicles, concentration, frequency, and duration of application. This is the differences between different agents. Rationale for the use of topical fluorides. At the time of tooth erupting, the enamel is not yet completely calcified. A tooth undergoes a post-eruptive period. This period is about 2 years, and this period names as enamel maturation period. If the saliva contains enough of fluoridation, fluoride disposition takes place in the superficial layer of enamel. It makes the enamel more hard. So, as immediately after eruption the enamel is purpose and immature, it more effective, this method more effective in 2 years after erupting.
The efficacy of topical fluoride depends on the concentration of fluoride used, the frequency with which it is applied on the duration of application, the specific fluoride compound used. Mechanism of action: fluoride ions. Fluoride ions, when substituted into the hydroxyapatite crystals, fit more perfectly than do hydroxyl ions. Also, the greater bonding potential of fluoride makes the apatite crystal more compact and more stable, thereby more resistant to the acid dissolution. When concentrated topical fluoride agents react with the enamel, there is formation of calcium fluoride. Commonly used topical fluoride agents include sodium fluoride, sodium monofluorophosphate, stannous fluoride, and aminofluoride, olefluor.
Local endogenous method can be individual and professional. Individual will be divided on fluoride-containing toothpastes, mouthwashes, and fluoride gels. And professional can be fluoride gels too, can be mouthwashes too, but concentration in these mouthwashes and gels will be higher. So, to the professional will be also professional fluoride pastes, fluoride solution, fluoride varnishes, restorative materials containing fluoride, etc.
Classification of deep fluoridation drug. Aqueous solution: sodium fluoride 2% and stannous fluoride 8%. Fluoride gels: acidulated phosphate fluoride 1.23%. Fluoride varnishes are Durafat, Fluoroprotector, Cavity Shield, Me Varnish, etc. Once more we have fluoride prophylactic pastes and restorative material containing fluoride.
Fluoride applied by self-applied. This method is most effective when using a custom mouthguard. This method can be divided on two groups: fluoride dentifrices and fluoride mouth rinses. Local exogenous topical fluoride applications. Topical fluoride applications as aqueous solution, and local exogenous method, of course.
Mechanism of action of sodium fluoride. When sodium fluoride solution is applied on the tooth surface, it reacts with hydroxylapatite crystals rapidly to form calcium fluoride. At first, the reaction goes quickly, then it decreases. This is called suppression.
Aqua solution divided into two groups, for application and for rinsing. For application, 2% sodium fluoride solution, 1 and 1.2 sodium fluoride solution acidified with phosphoric acid, and from 4 to 8% in fluoride solution. And for rising, the second group, 0.05% sodium fluoride solution, 100 ppm daily, and 900 ppm one time per week or one time in 2 weeks. Indications for aqua solutions. Patients who are at high risk for caries on smooth tooth surfaces. Patients who are at a high risk for caries on root surfaces. To reduce tooth sensitivity. White spots, active decay, special patient groups such as orthodontic patients undergoing head and neck irradiation, patient with decreased salivary flow, children whose permanent molars soothe but can't be sealed. Additional protection if necessary for children in areas without fluoridated drinking water.
Contraindication for aqua solution for defluoridation are not recommended for children under 6 years of age. Inability to rinse your mouth. Method of rinsing aqua solution for defluoridation. In the evening, before bedtime, after brushing teeth, hold the rinse from 1 to 2 minutes with using 5 or 7 milliliters of solution sodium fluoride.
Positive and negative sides of this method. Positive: maximum preventive effect in children at high risk of caries. Weekly rinses require little time, 5 minutes per week. The program is inexpensive and cost effectiveness very high. So, and we have negative sides, of course. First one is danger of poisoning if swallowed, inability to use in children under 6 years, requires adult control, effective only in combination with brushing your teeth.
Method of application: sodium fluoride for deep fluoridation. First, cleaning and polishing of teeth is done. Teeth are isolated with cotton rolls and dried with compressed air. Teeth can be selected quadrant-wise. 2% aqueous natrium fluoride solution is applied with cotton applicator for 3 minutes. Procedure is repeated for remaining quadrant until all the teeth are treated. Second, third, and fourth application are recommended at intervals of approximately 1 week, and they are preceded by cleaning and polishing. Patient is advised to avoid rinsing, drinking, and eating for next half hour. It can be prepared by dissolving 1.2 gram of powder in 10 milliliters of distilled water.
Aqua solution for application. Through oral hygiene, the patient is sitting straight. Use of salve ejector, cotton swab, insulation, drying by applicator. The solution is applied to the teeth of 1 quadrant for 1 minute, with focal demineralization up to 4 minutes. Positive of this method: high medical efficiency, and efficiency is more pronounced on smooth surfaces. And negative: the method requires careful work by staff. Solutions are unstable and from hydroxide and tin oxide, which precipitate. Tin fluoride solutions have an unpleasant taste. The method is disadvantageous at home. Local exogenous and fluorinated professional gels.
Fluoride gels and foams contain a high concentration of fluoride, typically up to 20 mg on gram fluoride.
Indication for fluorinated professional gels. Indications, contraindications, advantages and disadvantages are the same as when applying solutions, so we will not stop at this slide.
Gel may be contains sodium fluoride, amino fluoride, phosphate fluoride. The 4-minute application of fluoride gel is recommended based on studies of enamel fluoride uptake. When contact time is reduced to 1 minute, enamel fluoride uptake is significantly less. Method of apply gels for deep fluoridation. First one, good oral hygiene. Then injection of gel into standard disposable spoons or individual mouth guards. A quarter filled with gel and overlay on the teeth of the upper and lower jaw. Use of salve ejectors. Exposure time 4 minutes. Abstain from food and drink for 30 minutes. Repeated of procedure depends on from individual risk of caries and from therapeutic effect. 4-5 applications are performed for 1 ml, repeated after 3 months.
Positive and negative sides. Positive: high medical efficiency. Efficiency is more pronounced on smooth surfaces. The risk of fluoride injection with fluoride foam is reduced compared with gel because a small amount is needed for application. And negative: the method requires careful work by staff. The method is disadvantages at home. Local exogenous fluorinated professional varnishes.
A fluoride varnish is a professionally applied adherent material. It is not intended to be permanent as a facial sealant. The purpose is to hold fluoride in close contact with the tooth for a period of time. They permit the application of high fluoride concentration in small amounts of material.
Advantages and disadvantages. Advantages: medium and high risk of caries, medium and high risk caries activity, enamel focal demineralization, tooth enamel hyperesthesia, tooth period of temporary and permanent teeth. And disadvantages: individual intolerance to varnish components, Bleeding gums as the absorption of the base of the varnish increases and the risk of developing an allergic reaction increases. Positive and negative sides. Positive. The technique are simple. The varnish dries immediately upon contact with salvia. Caries reduction from 20 to 70%, depending on the frequency of application and the individual risk of caries. And negative. Utility programs is not cheap. Using children may react negatively to the pungent smell of varnish, and teenagers may refuse to use varnishes yellow-brown. Children with a low level of risk and caries activity are shown to conduct procedures 2 times a year. For children with an average level of caries activity every 3 months. Children with high level and caries activity 8–10 applications per year.
Method of applying fluorinated professional varnishes. Rational oral hygiene, tooth drying, thin coating. After the procedure, don't eat or drink for a half hour. Refrain from eating solid food and brushing your teeth for 1 day.
Fluorinated professional varnishes, rapid absorption of fluoride by enamel and dentin, increase in fluorine content in enamel up to 77%. Fluoride release within from 3 to 6 months. Fluorine containing filling materials, local exogenous methods. Examples of fluorine-containing filling materials are glasses ionomer cements, keranomer, compomers, fluorine-containing composites, for example, charisma F or charisma PPF. Glass ionomer cements contain up to 20 of fluorides, which are released within from 4 to 6 weeks, increasing the level of fluoride content to the level of 0.3 to 1 ppm. Thus, glass ionomer cements have a battery effect. And on this slide you see summarize of our theme, endogenous and exogenous method, and how many fluorine in ppm consist of method or vehicle. For example, all water supplies, fluoridated salts, or for example varnishes or gels. Fluoride prevention of caries is very important theme of the dentistry. So you know that yet, and see you later. Thanks for the attention.